Hi, I'm Dr. Lisa with Private Practice Made Easy, Your Turn to Lead. In this video, I'm going to show you some of the benefits of Heidi AI, which is a totally free resource that you can use. All right, let's go into Heidi AI. As you can see, I'm on the landing page here of Heidi AI. There are two different ways that you can go into transcribing. There's new session here and start transcribing here. So two different buttons. So when you're going into a session with your patient, you just click on start transcribing and it'll record the whole conversation. Now, you can get the transcript, or you can do a smart note, or you can actually just put in your own customized note. So, let me kind of show you how this works. I'm going to click on start transcribing. And as I'm talking here, it's transcribing everything that I'm talking about. The nice thing about Heidi AI is that it knows your voice. It'll get to know your voice and it will actually pick up what you're saying versus what your patient is saying. And you can have several people in the room, and it will actually put your name and then your what your voice has picked up and then what your patient has picked up and identify who's saying what, which is really nice. All right, so we're once you're done, you're going to stop transcribing and all these templates are going to come up. So you can do your own note, write a mental health progress note, or you can do even assessment. So what's really nice is you can do both at the same time. So I can write my mental health note, and there's my note. And I can also go back and do another note. I might want to do ADHD assessment from that visit, and it'll do an ADHD assessment. Now, if I want a formal assessment, I can actually copy this ADHD assessment and put it into ChatGPT. Now, you do not want, let me repeat several times to you, you do not want any confidential information identifying your patients in ChatGPT. Now, if you have a customized ChatGPT just for your practice, that's fine. And it's HIPAA compliant, you're fine. But you do not want to put any confidential patient information to ChatGPT. Okay? So if there's no name or identifying the patient, if you don't have any names and you didn't say any names, that's fine. You can copy here. You can go into ChatGPT and say, create a formal ADHD assessment using this information, boom, and put it in a Word doc or put it in a PDF. And then you can sign it, and there you have it. Now, what I like to do is I have my own confidential chat GPT for Turning Point Psychiatry. So I don't have to worry about those identifiers. But if I'm just using regular chat GPT, then I'm going to copy here. I'm going to make sure I don't have any identifiers on there. Now, certainly okay just to use initials or something like that, or if you have first name, but any other identifiers you cannot use. You don't want to use in Chat GPT. So you copy there, you put it in Chat GPT, you ask it to create um, a formal assessment and then put it in a Word document. Then you can go into Word and you can put save it to your desktop, and then you can put in your identifiers in there and then transfer it to a PDF. Okay. But you want to be real careful putting things into ChatGPT when it has to do with patient information. That's a no no. All right. So back to Heidi AI. When I go in here, I can also, if we go to note, let's see, select a template, I can make as many notes as I want from that one transcription, right? Say I wanted a referral to a therapist. then I go here to a generic referral letter, and it's going to put a referral letter together. So literally, you're not typing in anything. You're having a in real session, real time session with your patient, and you go in here and you create any note that you want. There is also a smart dictation in here that you can use. If you go here, oops, usually, let me see if I can get it from here. Smart, a note here. Let me take these away real quick. No, new smart dictation. Okay. I think I'm doing too much here. Let me wait real quick. Okay, it's still loading. But there is a smart dictation in here that you can use during your visit. And when you're done, oops, when you're done with the visit, over here on the right, it's going to have tasks that you need to do, a reminder. So if I told the patient, I'm going to prescribe buspirone 5 milligrams 3 times a day as needed, it's going to say over here, make sure you prescribe it. If I tell the patient, I'm going to send you a treatment plan, or I'm going to send you some homework, some worksheets, it's going to say over here in the right column, it's going to say you need to send them a treatment plan. So you can kind of check off what you need to do. So anyway, I hope you enjoyed this. I thought this was really cool. It really saved me a lot of time when I can just have the visit with the patient, when I leave the patient, the note is done. I do a couple clicks. I've got an assessment, my note, and a referral done. So use AI. If you're not using AI, you're going to lose time, and you're going to also be behind because it's coming. So if you resist it, it's going to be a problem. So if you have any questions about AI, any of the resources that I present to you, please send me an email. We'll do a discover call, and free discover call, and see how I can help you, because we want your practice to flow seamlessly, and we want to get back as much time as we can.